Most young people are exposed to drugs and alcohol in our society. A large majority of them, about up to 50 to 60% of them, use drugs in an experimental way. And a large number of them also socially use it. But the highest peak of drug and alcohol use is between 14 to 18 years. And a substantial minority, up to 15%, may continue to use that. So even though a large number of young people are using it, only a small proportion of them develop problems. If there is parents who are using drugs and alcohol, that's a high risk factor for young people, both from genetic and environmental factors. Plus a number of other factors, including the type of parenting, family factors, peer pressure. So a number of psychological problems, including abuse and neglect in children, a number of psychological disorders like ADHD, conduct disorders, and depression can increase the risk of substance misuse in young people as well. If you look at the risk factors that lead young people to substance misuse, include both sort of biological factors or genetic factors, as well as a large number of environmental factors. And at least about 5 to 10% are using alcohol on a regular basis. And binge drinking is a big problem in young people at this point in time. Cannabis use, again, quite prevalent. About between 30 to 40% of the young people have used cannabis, and at least 10% of them are using on a regular basis. It's also quite important for us to look at the change in trends in the use of various drugs and alcohol in young people. One of the things that we have noticed is that a significant rise in the number of young people engaged in binge drinking, which is one of the biggest cause of concern at this point in time. Binge drinking is all excessive episodic drinking. In the UK, we define it as using more than about 8 units in men and boys, and about 6 units in females in a single setting. It can cause significant problems for the young people, both in terms of having a number of risk factors for both into the brain and into the body, and also socially. The other high rates are also we see is in terms of use of cannabis, which is actually going up. And tobacco use has actually fallen to some extent, but it's kind of leveling off more recently. What we are seeing, interestingly, is that there's a decrease in the use of heroin in young people. But cocaine use is kind of leveling off, and it's not very high, but still the same. Most young people, drug and alcohol misuse is not a part and parcel of normal adolescence. Children and young people who are coming from families where there are problems, or young people who have been abused and neglected, who have got painful things in their lives, people who are using substances as a way of dealing with problems in their lives, they need early intervention. And many people are in contact with them, including people working in social services, people working in child health, mental health services, do have an opportunity to intervene early so that they before they develop problems. And we need a slightly different understanding about substance misuse in young people. They are not small adults, and we need to understand that we need to intervene early before the problems have developed. It needs much more of a concerted effort from the whole society, working with the communities and local communities and parents to reduce the impact of drug and alcohol misuse. A lot of education, a lot of interventions, but working largely with the community. That seems to be the answer. Early substance misuse on a developing brain is much more toxic than using drugs and alcohol in the future. And we might be able to identify the risk and protective factors much more effectively and try and develop effective intervention for young people with substance misuse.